Hey guys, Luis Moreno here with Think Medicare, Think ACA. I got a question from a newer agent asking me, Luis, man, I don't what is original Medicare? And then we got Part C, we got Part D, we got supplements. How does all that go together? All right. I thought, you know what? I'm just going to do a very basic intro video into how all that plays out for our Medicare beneficiaries. All right. So, but before I do that, please comment, like, and subscribe. This is going to be very, very high level here, guys. Okay. All right. So I am going to share original Medicare. Okay. You're looking at my whiteboard. Okay. Come on, give me a whiteboard. Let's go. Okay, here we go. All right. So let's say we're going to do OM, original Medicare. Okay. So this is Part A and Part B. Okay. Now, Part A usually is premium free. These are for people who have worked more than 10 years, 40 quarters. 1 year gets you 4 quarters. Okay. You work more than 10 quarters or 40 quarters, you don't pay for your Part A. People who have worked less quarters are going to pay. It's 518 and 250 something. Okay. They will pay for Part A if they didn't work enough. Now, Part B in 2025, the premium is 250, no, 185. Boy, I'm off. $185 for the Part B. Now, there are some people that pay nothing, and there are some people that pay a lot more. Okay, so it really just depends. Okay, so now, if people who have Medicaid don't pay for Part B, but they got to qualify for Medicaid. And then there's some high income earners that if they make too much money, then they're subject to IRMA, which increases the premium for Part B. And it can get as high as $628, depending on their income. But these are for people that are filing single, making more than $500,000, and if they're filing joint, more than $750,000. Okay. All right. So this is original Medicare. Now, original Medicare has a lot of holes in it. Okay. First of all, it doesn't cover any prescriptions that people will get at the pharmacy. There's no coverage for that at all. Okay. Now, if they end up going to the hospital and they get medications at the hospital, that falls under Part B. But Part B has a coinsurance amount of 20%. So these are insureds that could be on the hook for 20% of that. And they can get very, very expensive. Okay. Now, Part A has a deductible for every benefit period, which a benefit period is a 60-day window without any treatment. And that deductible is $1,676. So original Medicare in just by itself is not a good thing for a Medicare beneficiary to have. Now, somebody has original Medicare, they can go to any doctor, any facility, any provider, any whatever, as long as that doctor is either accepting assignment or not. If they accept Medicare assignment, that means that they are taking exactly what Medicare says they're going to pay for that procedure. If they don't take Medicare assignment, that means that Medicare beneficiary could be on the hook for more money. When they don't take Medicare assignment, it's telling the person that, look, we take Medicare, but we just don't accept what Medicare is going to pay us. We can charge up to 15% more, and you, Mr. Medicare beneficiary, are going to be on the hook for it.
Guys, I've got a community of ACA and Medicare agents that we're putting together. 25 years in business is what I'm going to be sharing with you. Guys, come join us at the community, a community of ACA and Medicare agents, and we'll show you how to grow.
Okay, so that in a nutshell is what Medicare or original Medicare is. Okay, it's that red, white, and blue card. Okay, and it's got the insurance name on top. It's got the MBI number, some letters and numbers, not their socials anymore. And it's got Part A and B with the effective dates right here. Okay, it's a red, white, and blue card. Now, a senior or Medicare beneficiary has a choice to make. They can go left or right. And I use this analogy, which is like buying a car or a truck. Okay. Is buying a car or a truck right or wrong? Kind of depends, right? Okay. Same thing here. Buying a Med Supp or buying an Advantage plan really depends, right? So a senior can go this way, and we'll call this option 1. A senior could go this route and buy a Med Supp or a Medigap policy and pair it with a prescription drug plan. This is part D. Okay. All right. They can go over here and they can buy a Medicare Advantage plan. And this is known as a part C. One or the other. Okay. They can't mix and match. All right. So it's one way or the other. Now, there are some pros and cons over here, and there are some pros and cons over here. Okay. The pros over here, and these are just things I'm going to come up with immediately. I have more videos that get in depth into here, but a Medicare supplement. Well, let me tell you the negatives first. On the negative is money. Okay. Because everybody will probably want to be over here, but they can't afford the premiums. So they're going to have to pay a premium for a Med Supp and a premium for a PDP. You know, Med Supps, depending on gender, whether they smoke or not, and also, you know, if they're not in their guaranteed issue period, maybe how they answer some of the health questions, the prescription drug plans, they have a premium. You know, they could be anywhere in the 150s, 160s, and on up. And that's a premium that they pay every month. Now, the good thing about the Med Supps is that people that are turning 65 now, they only have the option of buying either a G or an N. That's it. Okay. And we're not going to go into the details here, but pretty much most people get the G. The N, okay. And then they go buy a prescription drug plan, which now here you have to check the formulary to make sure that the medications they're taking are inside the formulary. Now, the prescription drug engine inside a PDP has gotten very, very good. Okay, in 2025, the engine completely changed where there's no donut hole, and the most that they'll pay is $2,000. It's gotten great. Okay, but again, the problem is the premiums. Now, on the positive side things, on the Med Supp, there's no network. They can go to any doctor that takes Medicare. And if the doctor does not accept Medicare assignment, the Plan G will pay for that excess. It's a good thing. If they take the N, it doesn't cover it. Okay. But it allows them to go wherever they want to go. Now, they do have to meet a small Part B annual deductible. And in 2025, that is going to be $257. So it's not that bad. Okay. Now, let's transition over here to a Medicare Advantage. A lot of people are taking Medicare Advantage plans because usually there's no premium. Okay, that's the big plus on here. Oh, let me go to another negative over here on option 1. There's no extras. Okay, a lot of seniors want these freebies. There's no gym membership. There's no transportation. There's no over-the-counter. There is no dental, vision, and hearing. Okay, all those things that they see on TV ads, they're not over here. So you're going to want to add a dental, vision, and possibly a hearing plan over here.
This video is being sponsored by Agent CRM. Agent CRM is a CRM that I use for my agency for every line of business: auto, home, life, commercial, Medicare, and ACA. It should be the CRM that you use too. Click up here to get some more information.
Okay. Now, Medicare Advantage, positive, it's a premium. Okay. Another positive, it has all those extras that seniors love. And it's kind of a pay-as-you-go system, which means you pay for services when you need them. Now, sometimes you pay zero. Primary care doctors usually have a $0 copay. A specialist will have a copay. You go to the hospital, it has copays. You go get some treatments, MRIs, whatever, you may have a copay or you may have co-insurance. The good thing is that they have a cap, a maximum out of pocket. Be as low as 3,700, 3,900, and it goes up to 6,000 and change. Depends on your plan. And in this world, you have HMOs and you have PPOs. Okay, so on an HMO, you got to make sure the doctors are in the network. That's maybe a good thing or a bad thing. In my county, it's perfect, no issues. Okay, there's no out-of-network coverage in an HMO unless it's an emergency. So all the doctors, all their specialists, the pharmacy, everything has to be in the network. On a PPO, a little different. On a PPO, you have in-network and out-of-network. You don't need referrals like you do in an HMO. But on a PPO, now what's going to happen is if you go out of network, you'll have coverage, but you're going to pay a heck of a lot more than if you went to go see a provider that was in the network. Your maximum out of pocket also increases if you go out of network. So not a good thing. Okay. But you get all the extras over here. So as ages, guys, you've got to decide, well, which, no, in fact, I take that back. You don't decide. You present both of them and you let your insurance tell you which way you go. Either way, you make a damn good living. Either way, you do very well. But present and let them tell you what they can afford and what they want. Now, if somebody has Medicare and Medicaid, guys, you cannot do a MedSupp. Okay, you're going to do an MA plan and you're going to do a dual plan. On the Medicare Advantage side, you've got regular plans, you've got chronic plans, which are designed for people with certain chronic conditions like diabetes. And then you have dual plans, which are designed for people who have Medicare and Medicaid. And what happens for those is they don't pay anything for medical, but their extra benefits get enhanced, larger amounts of those extra benefits. So you as the agent have to decide, what do I want to do? Which way do I want to help my senior with? And I think the best way to do it, guys, is just present both, let them know which way they want to go. Okay, give pros and cons to one, pros and cons to the other, and then let them decide what they want to do. Okay, and once they decide what they want to do, let's say they go with option one over here with the MedSupp and the PDP. Make sure you check the prescriptions of that PDP. Run them against the formulary, which is the list. Make sure they're covered or not covered. Okay, make them aware of whether they're covered or not, and make them aware of what the tier levels are going to be and what the cost is going to be. If you go with a Medicare Advantage plan, you got to do the same thing on the prescriptions that you did over here, but you also got to check the docs and make sure that all their doctors are in the network. Otherwise, when they go see that doctor, there's no coverage. If it's a PPO and it's not a network, they're going to pay a lot more. Still not a good experience for the senior to have to deal with that. So make sure you do your homework and then just present and let them decide which way you want to go. So I hope that gives you a very broad picture of what's going on. Oh, and I forgot one more thing. Okay. Let's see if my whiteboard is still up. Okay.
You want to know everything about ACA or Medicare? Click up here to get my ACA and Medicare smart books.
No, it's a goner, guys. Okay, so I forgot. So on the Medicare Advantage side of the house, you definitely want to pair it up with a hospital indemnity plan. An indemnity plan will help the insureds with the co-pays for the hospital, for the ER, and the ambulance. And there's some other ones that you can throw in. I usually don't. But then you can add a rider to this thing, which I do all the time, to help get them a certain dollar amount, anywhere between 1,000 to 20, for life-threatening cancer. Upon diagnosis, they write them a check. It helps meet that out-of-pocket that they have on these Advantage plans. So if you don't have a carrier for the dental and vision that you need to offer on the MedSupp, hit me up. I'll send you contracting for Emeritus. Great carrier, and they got a plan specific for seniors. Okay. Then, if you're doing Medicare Advantage, I love using Heartland National. So if you don't have a contract with Heartland National, hit me up and I'll send you contracting for that. You need to pair it up every single time and just present. and let them tell you what they want or not. Super easy and it's inexpensive. It's really a good thing for your seniors to offer that indemnity plan. So with that, I hope this gives you a better picture of how the Medicare world works. Make sure that you do a few things for me. Go down below and hit the description. I have a Medicare Smart Book that I sell in both English and Spanish. I have a ACA Smart Book in both English and Spanish. If you're not selling ACA and you want to, hit me up. I have an ACA 101 course. So if you suck at ACA or you want to get started with it, go watch my course. Man, you'll get like me. I have my CRM that I utilize. Okay, it's my communicator with all of my leads and my insureds, whomever I had as a contact. I use my CRM to communicate. It's called Agent CRM. If you want to have access to it, use my link and you get all the workflows that I have created for ACA and Medicare. Guys, you want to get it to communicate. If you haven't figured this out, a lot of insurers don't want to talk anymore. They don't have the time. A lot of them want to text. And within Agent CRM, you can make phone calls and record them. Secondly, you can also email from there and you can text from there. And everything is recorded in that contact file for that particular person. And then finally, a lot of you guys are on an island all by yourself and it's lonely. If you want to come to this island called the community of ACA and Medicare agents, where we're doing training, we're helping those agents with anything they need. We're running quote scenarios for them. We're really trying to provide an area where they can hang out and chit chat. But we do scheduled trainings with them. Guys, come join the community. It's $50 a month, and we'll make sure that it's well worth your $50. So the link is down below. Guys, don't forget to comment, like, and subscribe. If you're a subscriber, thank you. We're growing because of you guys. If you're not a subscriber and you're watching this video, guys, please subscribe. Hit the little bell icon, subscribe to our channel. Give me a thumbs up. Comment. I reply to all the comments myself. And if you got a suggestion on a video that you'd like for me to do, please post it and I'll do it. Thank you, guys. This is Luis Moreno with Think Medicare, Think ACA.